Today we are learning about antifungal drugs. Fungal infections are categorized into superficial and systemic infections. Fungi are eukaryotes, making them harder to treat without harming human cell, but they have unique targets, the cell wall and the cell membrane. Classification of antifungal drugs based on their chemical structure and mechanism of action. Polyene antibiotics, azoles, allylamines, echinocandins, antimetabolites, heterocyclic benzofurans. Polyene antibiotics. Systemic amphotericin B, topical nystatin, hemicin. Azoles inhibit ergosterol synthesis. Imidazole, topical and systemic. Ketoconazole, clotrimazole, miconazole. Triazoles, systemic and safer. Fluconazole, itraconazole, voriconazole, posaconazole. Allylamines, terbinafine. Echinocandins, caspofungin, micafungin, anidulafungin. Antimetabolites, flucytosine. Heterocyclic benzofurans, griseofulvin. Amphotericin B is highly lipophilic and has high affinity for ergosterol. It binds to ergosterol and aggregates to form artificial pores. These drastically increase the membrane permeability, allowing leakage of intracellular potassium ion and other molecules, leading to rapid cell death. What is ergosterol? Ergosterol is the sterol in fungal cell membranes. Therapeutic uses the gold standard for severe life-threatening systemic mycosis, used for cryptococcal meningitis, mucormycosis, invasive aspergillosis, and severe candidiasis. Often used as an induction therapy followed by an azole. Mnemonic for amphotericin B ADRs, infusion-related reactions. Shake and bake, high fever, severe chills, muscle spasm, hypotension. Pre-medicate with NSAIDs, antihistamines, and hydrocortisone. Nephrotoxicity, the most serious dose limiting toxicity. Direct tubular damage causes decreased GFR, electrolyte imbalance, severe hypokalemia, and hypomagnesemia due to renal tubular wasting. Azoles, fluconazole, itraconazole, voriconazole. Mechanism of action, fungistatic. They inhibit the fungal cytochrome P450 enzyme 14 alpha demethylase. This enzyme is crucial for converting lanosterol into ergosterol. The depletion of ergosterol and accumulation of toxic sterol precursor impair membrane fluidity and function, pharmacokinetics and interaction. Since they inhibit cytochrome P450 enzymes, azoles are notorious for multiple drug interaction. They increase the toxicity of warfarin, phenytoin, and statins. Specific drugs and uses. Fluconazole, excellent CNS penetration, drug of choice for oral, esophageal, and vaginal candidiasis, and maintenance therapy for cryptococcal meningitis. Itraconazole, drug of choice for endemic mycosis, histoplasmosis, porotrichosis, blastomycosis, and dermatophytosis. Voriconazole, drug of choice for invasive aspergillosis, visual disturbance are unique ADRs. Ketoconazole, rarely used systemically due to hepatotoxicity and anti-androgenic effect, inhibit human steroid synthesis causing gynecomastia and impotence. Used topically as shampoo for dandruff and seborrheic dermatitis. Allylamines, terbinafine, mechanism of action, fungicidal against dermatophyte. It inhibits the enzyme squalene epoxidase, which blocks ergosterol synthesis at an early stage. This leads to intracellular accumulation of squalene, which is directly toxic to fungal cell. Therapeutic use is highly concentrated in keratins, drug of choice for onychomycosis and trinia infection. EDRs, gastrointestinal distress, headache, and rarely severely hepatotoxicity and taste disturbance. Echinocandins, caspofungin, mechanism of action, penicillin of antifungals, non-competitively inhibit the synthesis of beta-1,3-D glucan, an essential structural component of fungal cell wall. This leads to osmotic instability and cell lysis. Therapeutic uses excellent for severe systemic azole resistance candidiasis, refractory aspergillosis given strictly through intravenously. ADRs very well tolerated, since mammalian cell lack of a cell wall. can cause mild infusion reaction. Histamine release causing flushing. Miscellaneous antifungals. Griseofulvin bind to tubulin, disrupting the mitotic spindle and halting fungal mitosis. Fungistatic used for severe dermatophytosis need to be taken with a fatty meal to enhance absorption. Novan cytochrome P450 inducers. Flucytosine, a prodrug, enters the fungal cell via cytosine permease and converted into 5-fluorouracil. Flucytosine inhibits the thymidylate synthase, halting DNA RNA synthesis. Used only in combination with amphotericin B for cryptococcal meningitis to prevent rapid resistance. ADR, severe bone marrow suppression.